Hi everyone, and welcome back to another INBDE prep video. I'm Macy, and today we're going to be exploring the ethical principle of veracity, or the principle that focuses on truthfulness. Veracity emphasizes that we must communicate truthfully to everyone we interact with as a dentist, whether it be our patients, the public, or anyone else we encounter in our professional journey. It also discusses all the different ways that we need to be truthful, which is probably more than you'd think, as this is the longest of all 5 ethical principles under the American Dental Association's Code of Ethics. Let's go ahead and dive right into some main ideas of this ethical principle. As we said earlier, the principle of veracity basically means to communicate truthfully, and this concept concerns 2 main ideas. Firstly, it focuses on the dentist-patient relationship and emphasizes that we need to be honest and trustworthy in this relationship. Any interactions or care we deliver to patients is grounded in the foundation of trust they have in us to deliver proper care and be honest when discussing treatment. I definitely wouldn't let someone I don't trust do dental work on me, so we don't want our patients to feel that way either. The second main concept that falls under veracity is adhering to intellectual integrity, which describes how we as the dentist should communicate without deception. We shouldn't say that a patient needs a pricier crown to restore their tooth when they could get away with the filling just fine. Another example would be over-exaggerating the need for an implant in a patient, when a bridge would also be a perfectly viable option. Pushing these more expensive treatment options when they are not the only valid option is really a half-truth and is deceptive and unethical. Both of these examples would be breaches in veracity. With this brief definition in mind, let's try a practice problem. Example number 1. While performing an extraction, the dentist begins luxating the incorrect tooth. The dental assistant provides appropriate feedback to help identify the correct tooth. What is the next best step for the dentist? A. Do not tell the patient and instruct the dental assistant to not tell the patient. B. Inform the patient, but instruct them to keep this information confidential and to not document. C. Inform the patient about the incident and document it. Or D. Ignore the situation by removing the correct tooth and hope the patient does not notice. Now go ahead and pause it and think about this question. The correct answer here, which I hopefully think you were able to point out, was inform the dentist about the incident and document it. This seems to be correct under the principle of veracity. You told the patient honestly about this situation and also documented it, which are the correct steps to take if this does occur. Now let's go through the other answer choices. Answer choice A. Now, a key part of veracity is to not be deceptive, and avoiding telling the patient about this is clearly deception, so it's not the correct step. Answer choice B. Now, although the patient was told about the situation, hiding the situation by not documenting it is still considered deceptive, and it's also a little suspicious to instruct the patient to keep this information confidential. Answer choice D. This seems to be the worst action to take. You are continuing the procedure without informing the patient of the mistake and completely ignoring the situation. This is a major breach in veracity. Now let's look at some more specific ways to honor the code of veracity via care representation. The first concept concerns dental amalgam and is almost guaranteed to be seen on your boards. It is incredibly important to know that you as a dentist cannot remove amalgam solely on the basis of it being a toxic substance. It is very unethical to tell patients they should get their amalgam fillings removed and replaced with composite fillings just because the mercury in amalgam is toxic and is bad for them. Extensive research efforts disagree with this claim. If a patient wants to replace amalgam fillings for aesthetic reasons, or they're in pain, or if they have an allergic reaction to the amalgam, then these are all different stories. But it is a breach in veracity for dentists to promote that amalgam fillings need to be removed solely due to toxicity. Now, the most common example you will see for this principle of toxicity is amalgam, but this concept actually applies to any dental material. The second care representation topic is about unsubstantiated representations, and it goes hand in hand with what we said about dental amalgam. Any claims made by a dentist must be backed by scientific knowledge or research. This includes any treatment options, diagnostic techniques, dental products, really anything we can discuss and recommend to our patient as a dental professional. A great example would be a dentist saying that fluoride has no dental benefits. There is an abundance of research showing the positive effects of fluoride, and going against this research in our recommendations would be unethical. Now, everything we're going to talk about concerning veracity and fee representation is incredibly high yield. I want to remind you again that any text you see in yellow for any of these ethics videos is high yield information and is something you should definitely focus on when studying for the boards. Fee representation should always be fair and transparent, and in no way should deceive the patient or any third-party insurances. With that in mind, let's dive in with the first concept that falls under fee representation, which is co-payment. The dentist cannot accept full payment without letting the coverage plan know of a waived co-payment. This basically means we can't tell a patient that if they get a certain treatment, we'll waive their insurance co-payment and just accept what the insurance pays for the treatment. This is untruthful to the insurance company and is a breach in Veracity. This is because this would lead to overbilling, since the insurance company is under the impression that the patient is being charged and that the bill is higher than it actually was. And speaking of overbilling, this is another unethical principle that falls under fee representation. We cannot increase fees due to plan coverage. Overbilling or overcharging a patient simply because they have dental insurance is definitely not truthful. And lastly, we'll talk about the fee differential, which says that fees should be consistent across all patients. This kind of ties into the previous concept of overbilling. The out-of-pocket fee for a procedure, or the fee for a patient with no dental benefits, should be considered the standard fee, and this fee should not change because a patient has insurance coverage. For example, if your fee for a crown is $700, then that is your fee for that same crown for any patient. You cannot charge a patient with dental insurance $900 for the same crown just because their particular plan will cover that much. All patients should be subject to the same standard fee, and no price should be inflated under the ethical principle of veracity. To continue with the topic of fee representation, we need to talk about treatment dates and dental procedures. We must always report the correct treatment dates and dental procedures to third parties, and any manipulation of these dates or treatment codes is unethical. Say a patient's insurance plan doesn't start until next month, but they want to get their work done now. You cannot just wait and process the treatment codes later when their insurance plan has begun. The same thing applies for reporting the dental procedures done. You cannot say you did a 1 surface filling when you actually did a 3 surface filling, just so the copay will be less for the patient. You also cannot recommend or provide any unnecessary services regardless of the contracts you may be in. If a patient doesn't need or want a mouth guard, it would be unethical to recommend one just because their insurance will cover it and you want the payment from the third party. Now let's look at some other ways to honor the code of veracity beyond fee representation. The next few concepts under veracity concern the code of professional conduct, and the first one is discussing conflict of interest. We must communicate vested interests to the audience when sharing educational information. If you are giving a talk about the benefits of a new toothpaste and the company is paying you to do so, you have to disclose that you are being paid to present this information. Another way it can be structured is via research. If you're presenting your research on the most effective toothpaste, and a particular toothpaste brand provided the grant to conduct this research, you must also disclose this information to any audience. Another aspect of professional conduct under veracity is professional representation. Dentists must not falsely portray their training or competence. We should always represent ourselves in a way that positively contributes to the reputation of the profession. Next, we'll talk about devices, drugs, and procedures, and how veracity plays a role. It is important that when utilizing these as a dentist, we only utilize approved drugs and devices. The full product information or formula has to be approved and available to the dental community. We cannot just use experimental drugs or devices on patients to test them out and see if they're effective. We also do not want to emphasize that a device or drug is the only product available to patients and misrepresent all the viable product options. The next thing that falls under this topic is adverse reactions. The dentist is ethically obligated to report harmful reactions to the healthcare community. This means that if a patient has an allergic reaction to the rubber dam material you are using, this finding needs to be shared with the dental community so other people can be aware of this possibility. Lastly, concerning marketing and sales, dentists should verify a product's representation and disclose all information to a patient. We should respect the trust involved in the patient-dentist relationship and should not be pressuring patients to purchase certain products in a misleading way. You're allowed to sell products like whitening kits in your office for a small profit, but it is unethical to make deceptive claims, like saying that these whitening strips will eliminate your need to brush your teeth, so you should really buy them. Your patient should also be made aware that you are selling these products, meaning any financial gains should be disclosed to them. We'll continue on to a huge part of veracity, which concerns advertising. Any advertisements made by a dentist cannot be false or misleading in any way. This includes fact misrepresentation. You cannot state that your root canal treatments have a 100% success rate if that's just not true. It is also a breach in veracity to exclude information, to make a misleading statement, or to set unrealistic expectations. An example of this is the Hollywood smile. It is unrealistic and unethical to advertise that all of your patients who come to see you, and see specifically you, will be able to leave with a perfect Hollywood smile. This is definitely not a guarantee and can certainly be misleading when you're advertising. Subjective statements are included in this false advertising. You cannot make billboards saying that you are the best dentist in the world and every other dentist does not compare to you. This would not only not make you very popular in the dental community, but it is also likely an exaggeration and not factual. It is also important to cite any necessary sources when publishing information to the public. This applies beyond advertisements to things like health articles and journals. Let's look at a few more ethical advertising guidelines to keep in mind under the principle of veracity. The first concerns degree usage and states that the announcement of unearned and non-health degrees is misleading. Of course, you may promote your earned advanced academic degrees like your DDS or DMD, but you cannot advertise those that aren't accredited by a general recognizing body. You cannot say you earned a fellowship in an unrecognized group, especially if it implies that you have skills or abilities that you do not. Additionally, announcing non-health degrees makes it seem related to the dental degree, which again is misleading. Next, we have referral services. Solely commercial referral services are unethical, and you cannot make payments to another person or entity to receive patient referrals. The last concept about advertising concerns websites and search engines, and specifically states that search engine optimizations, or SEOs, and websites must follow the code of ethics. You can increase the visibility of your website with SEOs as long as what you are promoting is not false or deceptive. You cannot hide untrue things on your website just to increase traffic. This is another breach of veracity. And finally, let's look at our last couple of veracity guidelines before going over some practice questions. These are both very important and are likely to show up on your exam. The first concept concerns your practice name. The inactive dentist name cannot be used for more than a year. This means that if you buy a practice or are an associate and the primary dentist retires, you are only allowed to use their namesake for up to a year before it must be changed and the public and patient pool must be notified. It would be unethical to continue to practice under the name of this dentist who is no longer present or providing care. Let's say you buy a practice from Dr. Crentist named Dr. Crentist Dentistry. If you keep this name for more than 1 year, you are violating the code of veracity. Technically, if you get authorization, you are able to use this name for more than a year, but you must still make patients aware of this arrangement with an announcement. Finally, let's talk about specialization announcement. Dentists can only announce a recognized dental specialty if they met the educational requirements and attained said certification. Additionally, the specialist must dedicate a significant portion of the practice to that specialty. For example, just because you as a general dentist took some CE courses on orthodontics and aligner cases, you cannot advertise that you are an orthodontist without the proper training and licensing. You also cannot say you're a specialist in something that is not a recognized specialty. You can't say that you are a specialist in implantology because this is not currently a recognized specialty. General dentists may announce services and other credentials, but not in any way that implies specialization. Now, I know that was a lot of information about veracity, but let's see if we can apply some of this knowledge. Example number 2. Which of the following actions adheres to the principle of veracity? A. Realistic dental expectations. B. A general dentist collecting specialist fees. C. Fee manipulation. Or D. Not reporting waived patient co-payment to third party. Now go ahead and pause it and think about these answer choices. The correct answer here would be A. Realistic dental expectations. A key part of veracity is to not be deceptive, and although it can be tempting to over-exaggerate your abilities, maintaining realistic dental expectations is the way to follow the principle of veracity. This seems to be adhering to the principle. Now let's go ahead and look at these other answer choices. Answer choice B. Now, although a general dentist can collect fees, the key thing that's incorrect here is that they're collecting specialist fees. Since our general dentist does not have any accredited degree for specialization, they should not be collecting such fees. This violates the principle of veracity. Now, answer choice C is clearly wrong. We talked about many ways that fees may be misrepresented, and manipulation of any sort is unethical. And answer choice D, again, by not reporting waived patient co-payment, we are misrepresenting fees because the third-party insurance may think the fee is more than reality. Therefore, A, realistic dental expectations, is the correct answer. Example number 3. A current orthodontic resident inherits a dental practice. While still a resident, several patients would like their orthodontic needs treated. What is the next best step? A, advertise as a limited practice in orthodontics and start treating all patients in need of orthodontic care. B, advertise the practice as a general dentist and only treat patients with general dental needs. C, advertise as a limited practice in orthodontics, start treating all patients in need of orthodontic care and charge a specialization fee. Or D, advertise the practice as a general dentist and start treating all patients in need of orthodontic care while charging a specialist fee. Now go ahead and pause it and think about these answer choices. The correct answer here is B, advertise the practice as a general dentist and only treat patients with general dental needs. Now, what we were looking for and trying to pay attention to in this question is the fact that the dentist has not yet completed their residency and they are practicing. We had to figure out what patients they're allowed to treat based on the principle of veracity. Now, answer choice B seems to be the right answer here because the resident, although trying to specialize, is still advertising as a general dentist and will only treat those patients he is qualified to treat, general dental needs. But let's go through these other answer choices. Answer choice A, since they have not completed their residency, it is unethical to advertise as such. Additionally, treating all patients that may need orthodontic care is unethical since the resident's not properly qualified. Answer choice C, this is clearly wrong as we discussed in option choice A. However, additionally, they are charging the specialization fee, which is not ethical since they are not an accredited specialist yet. And answer choice D, now this is interesting because they're advertising as a general dentist, which is the correct thing to do. However, if they are still treating all patients that need orthodontic care, the dentist is engaging in unethical behavior. Since they're not qualified, they should not be doing so, and once again, B would be the correct answer. Before we wrap up, let's do a quick recap of what we went over in this video. Under the ethical principle of veracity, we need to communicate truthfully. We know that dental care and fees must be represented in a manner that is not misleading or false. We know advertising must be truthful and well representing. And we know that we can only announce recognized specialties. Alright guys, that is it for today's topic. Thanks for watching and see you next time.